Hello everyone, welcome to Indian Anatomist channel. In today's topic, let us discuss about the
Cubital fossa. It is also known as the elbow pit or antecubital fossa, which is a triangular shaped depression located on the anterior or the front aspect of the elbow joint. Cubital fossa is considered as an intermuscular space because it is mostly bounded by the muscles. Most of the intermuscular spaces has certain boundaries that are roof, floor, bounded by the muscles and their contents. Generally, the roof is formed by the superficial structures like skin, superficial fascia and deep fascia or the respective deep fascia of that particular region. Here are some notable points, that is, the superficial fascia is always containing some subcutaneous vessels and nerves. Their names may vary between area to area. Mostly, the floor of the intermuscular spaces are formed by muscles rather than other structures like bone, ligaments, and tendons. Because the cubital fossa is a triangle-shaped intermuscular space, it has the following boundaries that are medial, lateral, apex, base, roof, and the floor. Coming to the boundaries of the cubital fossa. Laterally, the cubital fossa is bounded by the medial border of the brachioradialis muscle. Medially, it is bounded by lateral border of the pronator teres muscle. Apex of the cubital fossa, it is situated downwards, which is formed by the meeting point of medial and lateral borders. Here, the brachioradialis overlaps the pronator teres muscle. Base of the cubital fossa is formed by an imaginary line which connects the medial and lateral epicondyles of the humerus. Roof of the cubital fossa. From superficial to deep, it is formed by skin, superficial fascia featuring the median cubital vein that connects the cephalic and basilic veins, medial and lateral cutaneous nerves of the forearm. The deep fascia is reinforced by bicipital aponeurosis. The floor is formed by two muscles, brachialis above and supinator muscle below. Coming to the contents of cubital fossa. From medial to lateral, they are number 1. Median nerve. In the cubital fossa, the median nerve travels between the two heads of pronator teres. In addition, it lies superficial to brachialis, deep to bicipital aponeurosis and medial to brachial artery. At the same time, ulnar artery passes deep to the deep head of pronator teres. Second, the brachial artery and its bifurcation. The brachial artery terminates in the fossa at the level of neck of the radius by bifurcating into radial and ulnar arteries. The radial artery is located little superficial in the cubital fossa and exits the cubital fossa at the apex. In contrast, the ulnar artery is situated slightly deeper and goes behind the deep or ulnar head of the pronator teres muscle. The third content of cubital fossa is tendon of biceps brachii muscle. This lies lateral to the brachial artery in the cubital fossa. The tendon runs downwards laterally and is inserted into the radial tuberosity of radius bone. Before the insertion, the medial part of the tendon becomes aponeurosis, the bicipital aponeurosis, that runs medially and merges with the deep fascia of the forearm. The fourth and the last content of the cubital fossa is the radial nerve. It is present lateral to the tendon of biceps brachii. It lies deep to the brachioradialis muscle along the cubital fossa's lateral boundary. Here, the radial nerve divides into superficial and deep branches. In the fossa, the radial nerve gives some motor and sensory branches to the posterior aspect of forearm and hand. The mnemonic to remember the contents of the cubital fossa is MBBR. M stands for median nerve, B for brachial artery and its bifurcation, B again for biceps tendon, and the R stands for radial nerve. The anatomical layers of cubital fossa can be classified into venous layer, which consists the basilic, cephalic and cubital veins, aponeurotic layer, which consists of bicipital aponeurosis and biceps tendon, artery and nerve layer consisting of brachial artery and its bifurcation, median nerve and its branches, muscular layer consisting of supinator, brachialis and biceps tendon, and bony layer, the humerus, radius and ulnar bone. Next, let us discuss about the applied anatomy of cubital fossa. The recording of brachial artery pressure. One can measure the individual's brachial artery pressure by positioning the sphygmomanometer or BP apparatus cuff just above the base of the cubital fossa. To measure the patient's blood pressure, the stethoscope diaphragm is positioned either between the lower edge of the cuff or at the level of the base of the cubital fossa. The brachial artery pulsation. The pulse of the brachial artery can be easily recognized by placing the finger on the inner or medial side of the tendon of biceps brachii muscle. Cubital tunnel syndrome or ulnar nerve entrapment. It is caused by the ulnar nerve compression through a groove on the posterior aspect of the medial condyle of humerus. Symptoms of the cubital tunnel syndrome. They are the numbness, shooting pain and muscle weakness that occurs in the medial forearm, medial half of the fourth digit and full of the fifth digit. The causes of the syndrome are direct medial elbow blows, medial epicondylitis, baseball throwers, diabetes, supracondylar fracture and prolonged usage of computer and mouse. Venipuncture, which is also called phlebotomy, is a popular invasive way to get blood for testing or for later use like transfusion. It is also done to check the amounts of different blood components, give therapeutic treatments like medicine, nutrition or chemotherapy, and get rid of too much of iron in conditions like hemochromatosis or red blood cells in polycythemia. Commonly used vein for venipuncture is median cubital vein. Why is the median cubital vein the best choice for a venipuncture? The reasons are because it is a superficial vein, it is easily accessible, and it has a larger caliber. And next important reason is it is connected to deep veins through perforators that pierce the bicipital aponeurosis. This makes the median cubital vein won't slip away from its position during venipuncture.
Hope all of you would have understood in detail, which will be helpful for your studies. Let us be connected for the upcoming videos. Thank you all.